Can I also ask in terms of how do we better standardize TCM around the world? Because it's so customized, it's so personalized. For example, someone taking a TCM product in, say, Hamburg in northern Germany might be have completely different needs than someone who takes a TCM product in Graz in southern Austria. So, I mean, how do we really standardize this? Anyone, feel free to jump in.
Okay, may I respond first? Talking about
Professor Zhou, go.
Because as talking about standardization, as you may know, that we first in the very first beginning, we planned to have 3 sessions. The last session will be standardization of Chinese medicine, but we don't have time to arrange that session. So I would like to respond. Actually, we are developing this standardization at several levels. The first level is ISO standards, as Thomas mentioned. And also there are some organizations such as WFAS, World Federation for the Chinese Medicine Societies. They are also developing some standards for the practice of Chinese medicine in the whole world. So I think these organizations are developing some documents of standardization covering quality, safety, and also clinical practice. I think this can be very helpful for the standardization of Chinese medicine. So maybe other professors can input more information. Thank you.
Yeah, Professor Bauer, take it away.
I think standardization is really a multi-level process and strategy. And it means if we are talking about a standardized product, first, I think it's necessary to use, let's say, raw material with sustainable quality. And this, as I mentioned, is or can be almost guaranteed by cultivation. So I think it's important to use cultivated material which has a quite homogeneous quality. The second is you have to standardize the manufacturing process, which means the extraction process must be performed in a very consistent way. And finally, of course, the processing of the extract to make a tablet must also be standardized in the same way as it is done in Western medicine. So if all these 3 levels are controlled, then I think it's really possible to produce very consistent quality of products. And we have many examples in Europe, also with complex mixtures. We have a herbal mixture in Europe with 9 different plants and extracts, and it can be produced in a very consistent quality by using a tough quality control of the raw material, extraction process, and manufacturing process. So it's possible.
And I just point out some of the issue as from our experience in the TC249 program. Every country have their own expectation or their own standard. There's no unifying standard for all the countries. So it's up to the individual country to decide. So there will be a really challenge to develop something that applied to all. Another challenge, going back to what Thomas suggesting about the database, in terms of how do you control the quality of the data. Right now we have peer review for the publication of scientific research. So the data you have from one country or one investigator may not be up to the standard. So you may be misleading, getting some data that is misleading. So how do you control that? I think that's one thing we need to develop as a mechanism, how to standardize the quality of the scientific data, more so important than the product itself.